This program is brought to you by Emory University.
Are you
Then
seeing?
something flashed in right little in here.
Willie Collins is seeing light for the first time in decades thanks to an artificial retina system developed by the California-based company Second Sight.
This is a little bit darker color.
Emory Eye Center, headed up by Dr. Timothy Olson, is one of a handful of eye clinics in the U.S. using the new device, officially called the Argus II, but which has been dubbed the Bionic Eye. Dr. Joan Yin is Willie's eye doctor and surgeon.
This is number one, the first available FDA-approved treatment for patients with retinitis pigmentosa. And number two, this is the first device that we have to restore vision.
Retinitis pigmentosa, often called RP, is a genetic eye disease that can rob patients of some or all of their eyesight.
Oftentimes, the disease does not come about until they're in their teens or 20s. And they will first lose their peripheral vision, and then gradually they'll be left with a tunnel vision, a very small tunnel vision in both eyes. Very few patients actually will progress to lose their entire center vision as well, to the level of no light perception, and that's when they go completely blind.
Patients with RP who've lost all or most of their sight and have no other eye diseases, like Willie, are potential candidates for this cutting-edge treatment.
More when I go up.
It doesn't give detailed reading vision, but it gives patients the sense of mobility and orientation. And that's tremendously important for these patients who've had no vision at all.
The system is comprised of 4 major components: the glasses, which contain a small camera and transmitter, the power pack, which holds the battery, a receiver that is surgically attached to the eyeball, and finally, an electronic array tacked to the retina at the back of the eye near the optic nerve.
The receiver of the device is going to be implanted on the outside of the eye, and the receiver is attached to the cable, which is then attached to the array.
The eye must heal for a few weeks after surgery before the system can be tested. And we were back the day Willie had his bionic eye turned on for the first time.
Oh, the light. Bright light.
Initially, the effects were subtle, but as Willie began to get used to his bionic eye, some of the darkness began to peel away.
It flashed right then when I just came up.
Just look up just slightly.
Oh yeah, light.
As the camera captures an image, the system transcodes the brighter objects in the picture into a signal of flashes that are sent to the array and then onto Willie's brain via his optic nerve.
Yeah, so that middle flash is Bobby.
His grandson's dark jacket against the doctor's white lab coats demonstrates how Willie's bionic eye makes it possible for him to be able to perceive a difference between brighter and darker objects.
You just grabbed it.
That's where it was.
That's where it is.
Now it's on to rehab, where Willie will learn to use the device more efficiently and also test its limits.
You all right?
Yeah, I don't know where I'll be staying too much more of this.
The preceding program is copyrighted by Emory University.